Welcome back. Well, as the weather gets more spring-like, you may be up for taking your dog for a walk in the neighborhood or going to the park. It's a great time for our dogs to have a little bit of fun, social time with other dogs, but you want to keep your pet safe as well. Keeping up on important vaccines can help, so our pet vet, Dr. David Visser, is here to highlight an important disease called Parvo and how you can prevent it. But before we do that, we just have to confirm bunny's tails cannot fall off.
It can't fall off.
Okay,
if your bunny's tail falls off, call your veterinarian. You might call for a surgery.
Call on the Lord, because what's going on here?
Yes.
But Parvo, that's what we're here to talk about this morning.
Parvo is a disease. It's not really new, but it was new at one point. Before the mid-70s, there had not been Parvo in the United States, and it was an interesting thing when it first happened. And that virus was really severe the way it affected dogs, but has become a little milder over the years. But in the beginning, we didn't have a vaccine, we didn't have a test, so the profession went through a lot of change between then and now. Now we know a lot more about it, and it is something that pet owners need to be aware of, because every dog that doesn't have maternity or immunity from their mother is susceptible to coming down with this and needs to have the boosters of the vaccination to keep that immunity up.
Okay, so it's called Parvo, but is that like an acronym for something, or what does Parvo mean?
Parvo is just the name of the virus, and the virus itself, it's highly contagious, and I say that its strength is that it has a 1-2 punch. The first thing is that it destroys cells that are involved in the immune system. The rapidly dividing ones are involved in the immune system, the white blood cells, and so when you don't have enough white blood cells, you're more susceptible. The other cells that are affected is the digestive tract lining, so you get bacteria entering the bloodstream. With no immune system and with bacteria in the bloodstream, the body is really more affected by the bacteria that are affecting the rest of the body that wouldn't have.
And there's no way for it to fight, and they can't fight the bacteria because the immune system is suppressed.
Exactly. So that's how Parvo is a very serious condition. It just opens the door for bacteria that normally wouldn't have gotten there. That 1-2 punch then is something that's really important for people to be aware of, because treatment is not going to be as effective as prevention in the first place.
Okay, so are there any warning signs if your dog maybe has Parvo, or some behaviors that you could notice in them? Because again, they can't talk. Right,
exactly. We see this more in puppies, but any dog that's not vaccinated can be affected. The signs that a dog coming down with Parvo have, the very first sign that people will notice is that the dog is not eating very much, or the puppy is not eating very much. Loss of appetite becomes a complete lack of any food intake. Vomiting is one of the early signs as well, and as this virus again progresses, affecting the digestive tract, these pets can't keep fluids in their body. They're losing a lot of fluids and nutrition. They develop diarrhea, and the unique thing about this is that there's blood with this diarrhea. And I don't want to talk over somebody's breakfast except to say these signs are dramatic, and it happens so quickly that some pets that are affected will develop certainly the weakness associated with this. They can be non-responsive, and they can even pass away from this. So it's a very important condition to get early diagnosis on. The first signs that one notices is going to be important to take some action.
Like, don't just wait or just kind of dismiss it. Like, especially the not eating thing. It's like, if any being is not eating, there's something typically wrong.
Especially a puppy. You know, they eat everything.
True. Shoes, everything else. Okay, so this is really serious. So what's the treatment for this? What's the treatment for Parvo?
Well, once they get the virus, or once they get the virus and the disease is occurring, all we have is supportive measures. And remember that bacteria is the #1 thing that's causing these dogs to suffer and suffer the disease. And so antibiotics are a part of this as well. But they can't take in and have no willingness to take in food and nutrition and fluids by mouth. And so many of these pets need to stay in the hospital to receive IV fluids and IV nutrition while receiving high-powered antibiotics to make sure that the secondary bacteria are taken care of. The good news is that the immune system can come back around, and these cells on the lining of the digestive tract can grow back, but it takes about a week. Sometimes 3 or 4 days is the most critical time period that pets are in the hospital for that, but that basically after that, they can restore normalcy. But again, it's a touchy and dicey situation if they are seriously affected, and they're so young, so small, they don't have a lot of reserves to count on.
So preventative measures are key, are really important.
Yeah, that's really important. Vaccinations are given as a series, not so much that one builds up on the other and the other and the other, but rather vaccines are actually interfered with by the mother's immunity in the puppy during the early times. And we don't know when that immunity from the mother is low enough to have a vaccine start up and create new immunity going forward. This is the reason for the series. It's not that it builds up, but rather that we need to know and have something in place when the immune system is ready to be primed for ongoing immunity. So follow your veterinarian's recommendations for immunization for parvo. Usually covers other diseases at the same time, usually starting around 8 weeks and is completed anywhere between 16 and 20 weeks of age.
So then, okay, this is a question I have. You always have my random question, but
Love it.
So does that mean that, like, if you have a smaller puppy, then maybe just keeping them at home and not maybe socializing them as much with other dogs until they get on that series of vaccines?
Yeah, prevention is going to involve things like keeping a puppy away, especially one that's susceptible or not through the vaccine series, keeping it away from other places where this virus may be harbored. Now, this is a difficult balance because we want puppies to be socialized. We also want them to be safe. So we have to figure out how to have them socialize and be safe, and that might be involving somebody that you know has been through a puppy series, a vaccination series. Let playtimes and socialization occur in a healthy circumstance.
Okay, and this is something that we talked about when we were in commercial before we came on. There was like an outbreak recently here of a lot of dogs getting sick, and it ended up being parvo. We talked about this, and it was right around the holidays, and people didn't know what they were going to do. Should they board their dogs? Should they not board their dogs? It was I remember people being very scared.
You know, it got a lot of notoriety when dogs were dying for unknown reason. It turned out to be parvo. It did not turn out to be a more aggressive form of parvo. There were some questions about the testing and the immunization process that was going on. So it created a lot of notoriety in the state of Michigan, but glad to reassure people that if you're following the protocols for parvo control and prevention, you don't need to worry about an epidemic or a new outbreak. That was not fear-worthy.
Okay, and some tips on dealing with parvo.
Yep, dealing with parvo, certainly we want to keep pets in a safe environment, make sure that they're not exposed to other dogs that either have it or exposed to areas where our dogs have been out and about and dropping their stools that might have had the virus in it. Basically, contamination is fecal oral, in other words, from the stool to the mouth. And it might be that dogs walked through something and then they licked their paws.
Gosh.
So watch for those signs. It's really important to make sure that we're getting an early start. If we have a dog that is suspected of coming down with that, avoid those contaminated grounds we talked about. And vaccinating is probably the most important thing that you can do. Yeah, but the vaccine series is not complete until it's complete. That's kind of
there's adult boosters for it too. So even after they're out of puppyhood, there's adult boosters that they can get too,
It used to be that we had to give that every year. Now, after we've given the puppy series, it's good for 1 year, and then at that point, it's good for 3 years going forward. So the immune system is on the dog's side, but we need to make sure we're doing our part to keep that immune system up.
Definitely great information. Thank you so much, Dr. Visser. Listen, if you want to contact the pet vet, Dr. David Visser, you can reach him at the Center for Animal Health by calling 888-PETS-VETS, or you can always shoot him an email at michianapetvet@comcast.net. We'll be right back.